Okay, and moving right along, we've already talked about cirrhosis and what it is. It is characterized by diffuse, which means throughout, destruction and fibrotic regeneration of the hepatic cell. Most people die within 5 years of being diagnosed, and some a lot sooner. As necrotic tissue yields to fibrosis, the disease damages liver tissue and the normal vasculature. We know that all the blood from the lower end of the body comes through here, impairs the blood and the lymph flow through there, and ultimately causes hepatic insufficiency. So let's move on and look at the different types of cirrhosis. Alcoholic. Again, fibrosis and scarring. It's the oxidation of alcohol that damages the hepatocytes over and over and over. It's not just the person that occasionally has a drink. It's the alcoholics who are dependent on alcohol for survival. They have what we call bile caniculi or stones. Cirrhosis can begin in the bile and caniculi in ducts. Primary biliary cirrhosis can be autoimmune. Secondary biliary cirrhosis is an obstruction of the common bile duct through gallstones, tumors, or chronic pancreatitis. And if you're going to get cirrhosis, which is the biliary type, usually it's from a tumor, or chronic pancreatitis, which pancreatitis can also be caused by alcoholism. So alcohol is not a friend to the belly at all, either the pancreas or the liver. But biliary is, again, going to be secondary to something else, an obstruction or autoimmune. And then post-necrotic is a consequence of chronic disease. Any chronic disease, sooner or later, that affects especially the biliary tract, any of the processes that go on in the liver, and especially in the blood system. It's going to affect the liver. Okay. So the pathophysiology of cirrhosis is going to depend on the cause. Vascular changes comprise liver function. The process of regeneration is replaced by hypoxia if we've got a problem with the vasculature. Necrosis if oxygen in the blood is not restored. Atrophy or shrinking of the liver, and liver failure. Structural changes can result from fibrosis, which is a consequence of inflammation over and over and over. If we have too many of the inflammatory markers floating around, it can become fibrotic. Parenchyma of the liver becomes distorted. The biliary channels are altered or obstructed, producing jaundice. An obstruction will cause portal hypertension. New vascular channels form shunts, and blood from the portal vein bypasses the liver altogether. And again, here's our picture of the nodules, the gross, huge necrotic nodules on the bottom that are black, and then the cobbly appearance of the organ that should be shiny above. Oh, this doesn't look too good. Sorry, guys. I actually redid this too. Okay, so clinical manifestations of cirrhosis or signs and symptoms in the early stages: anorexia, nausea, vomiting, diarrhea. It's just sound typical of the GI tract. Dull abdominal ache from liver inflammation, and it's going to be high because that's where the liver is. Early stages, so you may not even know you have it. You may just think you have the flu. Late stages, respiratory, we're going to have pleural effusion, limited thoracic expansion due to abdominal ascites. All the fluid in the abdomen interferes with gas exchange, which can cause hypoxia. The central nervous system, progressive signs of the hepatic encephalopathy due to high ammonia levels, including lethargy, mental changes, slurred speech, paranoia, hallucinations, and even coma. And then hematologic, definitely the blood. We know that whole portal system is cemented, and it's the tract that goes in and out of the liver. Bleeding tendencies, anemia resulting from thrombocytopenia, secondary to splenomegaly, and diminished vitamin K absorption, and portal hypertension. Hematologic, they can have nosebleeds, very easy bruising into the tissues, bleeding gums, and obviously anemia. And then the brain, secondary to failure, the encephalopathy is secondary to failure of the metabolism of ammonia, because the liver does that also, and ammonia is toxic into urea, and consequent delivery of toxic ammonia to the brain. Ammonia crosses the blood-brain barrier, and it will cause damage to the brain. Late stages, you can see every system it affects. For endocrine, testicular atrophy, menstrual irregularities, gynecomastia, that's enlarged breast tissue in men, and loss of chest and axillary hair from diminished hormone metabolism because many of them are metabolized in the liver. The skin, we have abnormal pigmentation, spider angiomas all over the skin, palmar erythema, the palms are bright red, and jaundice. Jaundice is one of the cardinal signs and symptoms of liver infection and or failure related to impaired hepatic function, severe itching, and that is secondary to jaundice also from bilirubinemia in the blood. It causes extreme dryness in the skin and itching, and poor tissue turgor related to malnutrition. Hepatic, and that's the liver system. We have jaundice from diminished bilirubin metabolism, hepatomegaly secondary to liver scarring and portal hypertension, ascites and edema of the leg from inadequate portal perfusion or portal hypertension, and decreased plasma proteins, which is albumin, diminished albumin levels in the blood, hepatic encephalopathy, again from ammonia toxicity, and hepatorenal syndrome from advanced liver disease can lead to renal failure. Because remember, the liver is one of the excretory organs, and so the kidney is trying to help it out. And if the liver is sick enough, it's going to make the kidney absolutely overwhelmed and ill. Miscellaneous symptoms, in addition to everything else we've talked about, is if you need any more, you have musty breath, secondary, they say, to ammonia buildup no matter what you do with the mouth care, and large superficial abdominal veins, and that's going to be due to portal hypertension. They're going to distend just to try to help the heart out because it's a compensatory mechanism. Pain in the right upper quadrant because that's where all the inflammation damage is occurring in the liver, and it worsens as patient sits up or leans over because of the inflammation. That makes sense, putting pressure on that organ. Irritation of nerve fibers, high temperature due to inflammatory response, hemorrhage from the esophageal varices resulting from portal hypertension. So it goes on and on. I mean, if you didn't think the liver was important, all you have to do is read and try to digest everything we're talking about here. Complications of cirrhosis, we just talked about many of them. Respiratory compromise due to ascites and the portal hypertension, ascites fluid, portal hypertension, jaundice, coagulopathy, hepatic encephalopathy, high ammonia levels, bleeding through esophageal varices, acute GI bleed, liver failure, and then finally renal failure. So how are we going to diagnose this monster? Usually it's a liver biopsy, abdominal x-ray. Sometimes they can just see that it's giant, and then they'll go in and look at the liver. More from biopsy is if they're looking for liver cancer. But for cirrhosis, they usually do it through the EGD, which is the esophagogastroduodenoscopy. It's a tube that they put down upper GI through the esophagus, into the stomach, and into the duodenum. It can reveal bleeding, esophageal varices, stomach irritation or ulceration. The blood studies, how many things can go wrong with the liver. Elevated liver enzymes, sky high. Total serum bilirubin and indirect bilirubin, sky high. Diminished levels of serum albumin in the liver. There's no albumin, there's no protein for the blood. Regular proteins, aside from albumin, hemoglobin and electrolytes can be all thrown off. Prolonged prothrombin time or bleeding time because our coagulating factors go through the liver also. And if we have prolonged bleeding times, we have bleeding. We have a GI bleed. Diminished hematocrit goes along with the bleeding, and deficiency of vitamins A, C, and K. Urine studies will show an increased bilirubin. Should not be bilirubin in the urine. It should go out the stool, and again, causes the stool to look like it's brown. Treatment of cirrhosis, well, it's a systemic disease, so we have to see what it's affecting and then treat that. Vitamins and nutritional supplements, that goes without saying. Antacids to reduce gastric distress and bleeding tendencies. A potassium-sparing diuretic to reduce fluid accumulation, and potassium-sparing because probably the kidney is going to be affected sooner or later. Paracentesis to relieve abdominal pressure. That's where they put a catheter in your abdomen and drain the fluid of the abdominal cavity out. An esophageal balloon tamponade to compress bleeding vessels and stop blood loss from the esophageal varices. If we've got varices and outpouchings of the big vessels in the esophagus, they put a little catheter down your throat and they blow up a balloon to actually put pressure. It's like putting pressure on a bleed in the skin, only they put this tube down and the balloon compresses the varices to stop the bleeding. So that's just some of the things we can do, but it just depends on how the cirrhosis is, how far it is and what's going on with all the different systems that we just talked about. All right, we'll look real quick at the disorders of the gallbladder, which is basically going to be inflammation or cholecystitis or an obstruction. Cholelithiasis can be gallstone formation, which is going to usually be the obstruction. The types, cholesterol most common, and then pigmented from a cirrhosis, and cholesterol meaning they have too much fat in their diet. Risks, again, obesity, middle age, usually it's female. They used to say female fat and 40, the 3 Fs for an obstruction of the gallbladder or gallstone. Native American, they're usually white, and gallbladder, pancreas, or any other type of ileal disease. Usually the gallstones lodge in the cystic duct. When the bile flow is blocked, the gallbladder becomes inflamed and distended. Bacterial growth, such as E. coli, can actually contribute to the inflammation. The clinical symptoms of infection of the gallbladder, or inflammation, I should say. Acute abdominal pain in the right upper quadrant and may radiate to the back, between the shoulders, or to the front of the chest. Because it's so high and where it sits, a lot of women that come in 40s and 50s that have it, women more than men, they slap EKG leads on them. They think it's their heart. When they rule out the heart, they start looking for other things, and sometimes that's when they find the gallbladder. Because also nausea and vomiting is triggered by an inflammatory response, and a lot of times with an acute MI, myocardial infarction, you're diaphoretic too, but you're having nausea and vomiting. Chills can be related to a fever, and then jaundice from the obstruction of that common bile duct. The complications to gallbladder would be perforation or an abscess formation, a fistula formation. They can hepatitis, pancreatitis, cancer, so forth and so on. Usually the pain is so great though that they can discover it before it gets to that. Diagnosis: ultrasound can detect gallstones 2 millimeters, so very, very tiny. Serum levels, blood levels of serum alkaline phosphatase, aspartate aminotransferase, so forth and so on, and total bilirubin will be high, and then they'll rule out things for the liver and then go up to the gallbladder. White blood count, it's an infection, usually will be high. And then how are we going to treat it? We're going to talk about that hopefully in our final segment of the gastric dysfunction. So hang on.